Hey y'all, last time I was with you, I talked a little bit about Candida albicans in part 1. What is it? And I was talking about depression, anxiety, irrational irritability, bloating, diarrhea, constipation, heartburn, loss of self-confidence, lots and lots of anxiety, not being able to sleep. And so it could be a lot of things, right? We go to the doctor and the doctor will say, well, you know what, you can't sleep, here's something to help you sleep. You have bloating, gas, and distension, maybe you just need to have this stool softener here. And a lot of times what happens to us in our lives, and it happened to me, is that we can see a lot of doctors and we can always be treating symptoms but never really get to root cause. So when I talk about Candida and people say, well, I'm going to my doctor, I don't think I have this problem, I always ask them, would you like to at least discover if maybe this is your problem? Well, most people say yes. And I say, well, it's pretty inexpensive, really, way to find out. You don't have to see a really big expensive doctor and have 100 tests run. It's pretty easy. And the biggest thing is to start actually treating it naturally at home. So today, right now, I wanted to talk about one thing. The causes of Candida can come from. So I'm just going to mention a few of the things. So it's repeated antibiotic use. It's usually the most common cause. People will say, well, I only did it once, I had a tooth problem or this happened. But if you, again, remember that antibiotics, the word means anti-life, and probiotics means pro-life, you can start understanding a little bit about what happens. So on antibiotics, it wipes out everything, not just your bacteria problem. Plus, we have a problem where a lot of doctors and MDs will say something to a client or a patient like, you've got pneumonia, here's an antibiotic. And what I always ask my clients to ask is, could you please swab me? Could you please find out if I have the bacteria? Because so many times it's just handed over the counter or we go and get a prescription filled just to sort of, maybe for the practitioner or maybe for the doctor, actually cover their own butt, so to speak, so that they're not held accountable later and they can say, I gave them an antibiotic. A lot of times patients will keep coming back, and so the doctor feels maybe pressured upon to give the patient something. So if you've done that, if you've had recurrent sinus infections, which is a prime example, get onto Google and start researching sinus infections and look for the Mayo Clinic, because it actually came out in the late 80s. It was like 1989 where they actually said, do not get antibiotics for sinus infections. We now know it's a fungus. So what do antibiotics treat? Bacteria, right? So if you have a fungus going on, antibiotics will actually feed and create more of the same problem. So antibiotics, unfortunately, can throw gas on an already sort of small fire and then create a far worse fire going on in your system, in your gut. So repeated antibiotic use is the highest cause. Another big one would be birth control pills. Because they are hormones and because we now know that Candida and yeast and different things, they like to use hormones as receptors. They will literally be on the receptors and steal your hormones. So that's also one of the reasons, one of these times we're going to talk about hormone creams, etc. I'm really careful about that because of the way that yeast likes to work and fungus, and they love hormones as food. And I would say most of the birth control pills and patches out there are synthetic anyway. If you do go with a natural form, which I talk with women about all the time, also be careful, because many times those are phytoestrogens like soy-based products that can produce a lot of other unhealthy issues. So, what I always say, there's a lot of things you can do to balance hormones, and the last step I do would be creams. Plus, if your practitioner is giving you a cream and they're not actually constantly monitoring you and they're not looking at your steroidal pathway and where your supplementation is going, you might have, for example, a problem with cortisol. You may not be producing enough cortisol, which is very important for, it's basically used for your energy every single day. You know, cortisol is also something that really helps us with when we have body pain and anything. It's always this thing that comes in and helps neutralize that. But when we're not producing any cortisol, and maybe our pathway, our adrenal glands are pretty, you know, flattened, and we're just not producing our cortisol every day, and you're taking an HRT, and maybe you're taking some estrogen, and maybe you're taking progesterone, the body will literally steal it to make cortisol. So a lot of times women are saying, I'm on HRT, I'm taking, you know, some hormones to help me for this, you know, maybe I'm in midlife. And maybe the body is stealing that to make cortisol because of the steroidal pathway. Maybe over here, you've got a real big weakness and the body's robbing Peter to pay Paul. So we don't always know if taking hormones is necessarily going to the place that we would like that to go. So, and again, as we've all heard a million times, everything goes back to the gut. So a lot of times, you know, people will be on these HRTs and they have other gut issues. They've got Candida going on. They've got leaky gut syndrome going on. They might have H. pylori and other things. So that's really not going to be the answer to their problems. But anyway, that was one of the potential causes of having a Candida and fungal condition in the body. So also cortisone drugs, if you've had cortisone injections, if you're on prednisone, corticosteroids like that, can do also a lot of damage. Antibiotics and most prescription drugs, even over-the-counter Tylenol, Advil, Excedrin, etc., and even caffeine, can destroy the healthy flora. So this is another thing people don't understand, is that a steady diet of this can keep your gut in this same condition. So one of the things I also want to discuss was I have a lot of clients who talk about being on a healthy diet, and they will come to me and say, you know, I've been really radical with my diet. I've been eating well. I'm not eating carbs. They're really taking a proactive stance with their lifestyle and diet, but they've not lost weight. They're not feeling any better. So when we talk about bugs in the gut, and especially yeast, because it's fungal, it's not bacterial. I mean, you can't take things that you would take to kill a bacteria and then deal with the fungus. So fungus is pretty invasive, and it can survive and even change strains. We call it actually polymorphic, which means you can kill a strain of it and then it'll just switch over and keep surviving. I mean, it's been around for however many years you think the earth is old. That's how long it's been around. So when people just change their diet and then they say, well, I've changed my diet, you know, that will not kill it. So it's always unfortunate. I will say, however, foods like omega-3 fats, really, you know, good fats that are unrefined, that are not a trans fat, do wonderful damage to yeast and other bugs. I mean, good fats, and I'm going to tell you guys, you have to go to a health food store and you need to buy oils and fats that have an expiration date on them. I mean, we're talking fats that if they go rancid, you would know, because you're going to taste that and you're going to know. So it's very important that you buy fat and oils that can go rancid. So a trans fat, something that most restaurants cook in, even healthier restaurants. And trans fat is something that even if you buy organic boxed food, most often has a trans fat in it. So trans fats have been changed. They don't go rancid, right? They can sit on a counter. They can sit in a shelf for 3 or 4 years and not go rancid. So we know that they have to be changed in order to do that, right? So again, good fats are a good part of the diet for yeast eradication. A lot of good foods, paleo style. I always buy pasture finished meats. And if you're buying meat that just says grass fed, really, they could have had 1 day of grass feeding on this animal and you don't know. So I'm something like uswellnessmeats.com, something like there's local areas. I am a Weston A. Price chapter leader. If you email me at nethersprings2015@gmail.com, I will send you a local resources list if you happen to live in the Temecula, Murrieta, Southern California area. So anyway, so good food is wonderful for helping the gut heal, but as I've been saying, it will not kill the yeast and it will not do damage to these types of parasites. So what I always say is, yes, the diet is number one. We've got to change diet. We've got to look at lifestyle issues. We cannot continue to bring in huge amounts of sugar and refined carbohydrates, and it will definitely affect the feeding of your yeast if you continue on a diet like that. So I'm not saying diet is not important, but we must also come against the bug. So, one of the things that people don't understand is that when Candida albicans has a firm hold on the gut and you have leaky gut and its toxins, its 178 toxins are going daily and moment by moment into your bloodstream, it can paralyze your immune system. And here's this book I told you guys about last time, The Missing Diagnosis. And, he's even talking about this in the 70s, early 70s. And he's saying here that it will be noted, okay, that the yeast will weaken the immune defenses acting by stimulate. It just basically is like pulling a blanket over the immune system from all these toxins. So here you are eating this better diet, and unless you're going to come in with something to actually kill that yeast and actually flush it out of that body, you're still going to have the problem. And the problem is going to continue to weaken your immune system. So what I like to do is, number one, diet and lifestyle. Okay. Number two, a rotation of natural antifungals. And I have a way of doing this now that I've been doing for many years with my clientele that works wonderfully. So you want to bring in the natural antifungals and you want to bring them into the body. So if you're going to a practitioner and they just hand you a lot of pills to do this, for me personally as a practitioner, and because I look at poop every day because I'm looking at bowel elimination through the colonics, I've really noticed that the best way to get to this yeast is to take something by mouth that's going to travel through 23 feet of small intestine and 5 feet of bowel. So that's almost 30 feet, mouth to anus, right? And we know that Candida, and we know that these bugs love to live in this biofilm and the lining of the GI tract and the bowel. So we need to find a way that not only by eating this great diet that we'll talk about in further videos that we're going to do, but you need to bring in some natural antifungals and antimicrobials to come against these bugs. So what I do is I use a vehicle. I use a vehicle to bring the natural antifungals and antimicrobials through the intestinal tract. So I'm not just handing people pills. Pills can be good, but most of the time get as far as the liver and maybe the duodenum, and they get into the blood right there. But they're really not, traversing from the mouth to the anus, really staying in that intestinal tract and pulling that antimicrobial and antifungal through the intestinal tract until elimination happens. So I love Doug Kaufman. If you want to follow him on the internet, it is knowthecause.org, I think. Anyway, Doug Kaufman also has a page on Facebook, but one of the things he always says is think fungus first, and I always do. So the whole idea is you want to have the antifungals and you want to have the antimicrobials, but you want to have what's called an antimycotic that's going to actually bind with these antifungal and all the die-off of your yeast and pull it out of the body. Because the last thing we want is to kill off a whole bunch of yeast and have a big die-off going on and then having the carcasses and the dead bodies of these things kind of stuck up in the bowel. And what I have noticed over years as a colon therapist is when people get a lot of die-off from yeast, they will tend to get constipated. They generally do not have proper bowel movements during this time. And this is why enemas and colonics are so valuable during this recovery. So you really want to have those bowels moving. And so I use, antimycotics. I'm going to use something like psyllium husk. If people can't do psyllium, I'm going to use slippery elm. I can use acacia pad. There's many different kinds of natural, good types of fiber that we're going to bring the dead bodies out of the body, and we're going to have this biofilm start to shift off the walls of the intestinal tract, and it's really valuable that you do this. I also do use, for the biofilm disruption, I have used enzymes, and there's lots of different ones out there. For the serapeptase can work, but the problem with soy-based products I've noticed is people can even be sensitive to these enzymes that are going to chew up the biofilm if they are soy-based. So I have found others that do not have a soy base. So anyway, so there is a process to doing this, and then what we really want is a shift to happen because, I'm telling you guys, yeast and bugs are not sitting there in your intestinal tract going, okay, here I am, kill me. Really. Yeast lives in many forms, and as a colon therapist, I've seen many forms of yeast. Yes, it can be a white flake, and it can be on your tongue as this white coating, but as it matures in the gut, and as it starts to infiltrate that lining of the gut, and it can help create leaky gut, it's actually going to get these rhizomes, which are like roots in a plant, and it's going to implant right through that gut wall, and it's going to be in there almost like a plant, and it's rooted. So that there's stages, just like a growth of any plant, it starts young and it's going to mature, and it starts to mature in the gut. So it can become a little complicated getting rid of yeast. And again, the older and more mature it gets in the gut, the more toxins it's really sending out into your bloodstream. And as I've said, it paralyzes the immune system, and the immune system is just too many toxins. It's too much. If you have other immune system issues you're already dealing with, this can be all proved to be too much. Now, there are doctors out there and books that are written on something called ozone therapy, and it's medical ozone. And you're using ozone with oxygen. That's medical ozone. Do not think about those air purifiers that used to be out, 15, 20 years ago that put ozone in the room and people were breathing it, and that was a bad thing, because you look up ozone, everybody's scared of it. But really, when you have it with oxygen, and there's lots of great doctors out there that are using ozone therapy. Ozone is a great immune system stimulator, so it's going to hold that immune system up while we go through some of the detoxification process, which I found to be extremely valuable. And that's my own personal story, because I was totally incapacitated with fibromyalgia, chronic fatigue, lupus, MS, and eventually breast cancer. And my immune system was flat. I didn't know at the time I was gluten intolerant. I was still eating foods that were inflammatory to me. And I think it was, mostly ozone therapy that really started to hold that immune system up as I was able to do some of these other things to start getting well. So today I was talking about the causes, back to quickly the causes. So of course, antibiotic use and other prescription drug use and antidepressants and all sorts of prescription drugs, they all damage our flora. They do damage to the microbiome of our body, and that is such an essential aspect of getting well. So birth control pills, I talked about, cortisone drugs, overconsumption of sugar, refined carbs. It greatly affects the balance of good flora in the intestinal tract. I will just say right here, I'm old enough that in first grade we made glue, and we made our own glue. We used to put little macaronis on paper, and stick them on there with glue, and we made pictures. You know what we made that glue with, you guys? And we also used it for wallpaper glue back then. It's flour and water. So I don't care if your grains are organic. I don't care if they're einkorn wheat, which I get from people. So anytime you're looking at a flour-based product, which would be pasta, all breads, and breakfast cereals, and you mix that with a liquid, you're going to get glue. That is not the proper fiber to bring to cause good elimination in the body. So when people tell me I'm taking lots of fiber and they're telling me the grams of fiber, I'm always very careful to ask them, what kind of fiber are you using? Because it really matters, right? So I just wanted to say that overconsumption of sugar and refined carbs, you might say, I don't eat refined carbs. I'm eating Ezekiel bread. I'm eating sprouted grains. So we really have to talk about grains, and we have to talk about the reasons why they can be so detrimental. And it's not just gluten intolerance. We have an anti-nutrient problem where they need to be soaked, they need to be sprouted. And even then with people, there's just big problems with trying to assimilate and digest them. And I know I can hear people out there just, but yeah, problems with grains all over. I mean, just the mold content, the aflatoxic and mycotoxic mold content on grains, all of them, which includes rice. This includes corn. Corn's a big one for fungus. So, and you start talking about grains with people, they don't want to talk about some of these aspects. I mean, even when they feed factory farmed animals, they have to regularly test, the how much fungus is in their grains that they're feeding these animals. So first of all, we have a limit that our, the EPA, our environmental, they watch, how much aflatoxic and mycotoxic mold can be on these for human consumption. Then when it passes that amount, then they're saying, well, wait a minute here, we can't even let the animal, well, we'll send it over to the animals. Then the animals, it starts getting too high, the mold, and so then they send it over to distilleries, and this is what we're getting alcohol from. So it's really important that people understand aflatoxic and mycotoxins and this mold. This is on most grains. And if you live in California, most of the grains are sprayed anyway. And I know whenever I tell people that, they can't believe it, but you can find this information out, and even if it says organic, most of them have been sprayed to even come into our state. If you know about nuts, grains, and seeds being kept in silos, of course, silos are dark, they're damp, and we have a big problem with mold. So yeah, so that's the thing. So that was part of the diet. Anyway, also vaginal yeast and parasites can be transmitted from an infected partner. So I do want to say it can happen. H. pylori even is contagious. So and so is really yeast is an STD to a degree. Someone can have thrush on their mouth. We can have vaginal yeast infections that happen. So this is important too. I mean, if you clean yourself up or you're with a partner who hasn't, it can be a reinfection. So this is a really big deal. Higher progesterone levels. So when women are pregnant and they're going through the third trimester and their hormone levels are really higher, this tends to be a time when they're craving lots of these funky foods and a lot of, maybe sugary based foods and carbs. And, you have that baby. And so through these months of being pregnant, there's a yeast condition going on and there's a fungal condition. And then you have this baby and your hormone levels just hit rock bottom. And this can be a big part of postpartum issues. So you really have to imagine that while pregnant, and especially if you've had babies, I had 3 babies in a row, your levels of fungal problems can really increase during that time simply because of these high amounts of hormones in the body, naturally speaking, right? And the kind of diets that a lot of us end up on while we're pregnant, not to mention if they decide to, nowadays they're giving women who are pregnant antibiotics, through the pregnancy. Okay, so I always ask people to always check their water. Make sure you've got a healthy water and you're not drinking tap water. Tap water can definitely affect your gut, and it can definitely be containing chlorine and different things that can affect your microbiome, your gut health. So number one, changing our diet is number one. Number two, my antifungal, my antimicrobial regime that I use using fiber as an antimycotic to pull it out of the body. And we rotate these antifungals so that we're going to kill these and these antimicrobials to kill the fungus and to kill any other bugs that we have found. And then the third step I like to do is going to be adjunct therapies. This is why I am so big on enemas and colonics, especially during the recovery. This is my personal specialty, and I know lots of practitioners that I respect highly do not even understand the value of having enemas and colonics. And I want to say again, it's not just about getting poop out. Many people, they start taking these antifungals, antimicrobials, they start trying to correct their body, and they're taking a lot of supplements from practitioners, and they're just not able to process it because their liver's congested, and they've got a big candida problem, and they end up in bed, and they feel like they have the flu, and they feel sick. And this happened to me. I was this person that couldn't do anything. Every program they tried to put me on, I got sicker on it. I was also highly sensitive to every food out there. I mean, my gut was so sick. So again, the value of colonics and enemas. When people can't afford colonics, I teach them how to use enemas. Keep that bowel open. Every time we do enemas, every time we're doing colonics, we're also prompting the liver to release more bile. We need an increase of bile production, and it's so valuable, you guys. Anyway, I'm kind of getting too long in this video. It's already 22 minutes, but I'm going to increase these. I will do the next one in a few days. So, hey, part 2, part 3 is coming, and we'll talk to you real soon. Bye-bye.